Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Tonight we are taking off the gloves and it's no holds barred discussion on fight medicine. Wrestlers, boxers, and mixed martial artists who ignore injuries or fail to seek optimal health care often pay for it with pain, frustration, as well as lost training time. With the popularity of MMA and Jiu-Jitsu on the island, ExpressCare's Dr. Jitka Lom joins us in studio. She's stepping into the healthy living ring tonight to tell us all about those crazy ears, those black eyes, cuts and bruises, and much more. Thanks so much, Doc, for coming in. So we all know the popularity of the whole like PXCs and UFCs. But let's talk a little bit about those people who are involved in, this. And I think the most noticeable thing is what they call, I think, cauliflower ear, the grappler's ear. Oh, first off, what causes all of that? And can you ever fix it back to normal?
Yeah, this is a tough one. So, the way our ear works is that we have the skin of the ear sort of like it's like a sandwich. You've got the skin, and in the middle you've got the cartilage of the ear. And the cartilage is kind of like squid. It feels like that. It kind of looks like that. It's kind of glistening and white and shiny, and there's not a lot of blood supply to the cartilage. It's bathed in blood, and all these little tiny blood vessels in your ear between the two sandwiches of the skin, and or the two pieces of skin in between there's the cartilage. And when you get mushed, when your ear gets mushed on the floor with an opponent, it kind of shears those blood vessels. So now there's not a good blood supply to that cartilage. Of course, the ear blows up, looks like a Mickey Mouse, and it's very, very swollen, right? And bruised. And now nowhere for that blood to go because it doesn't have a circulation there. All the blood vessels are ripped. And so it just sits there, gradually, basically starving that cartilage of its blood supply. As a result, the cartilage kind of dies and shrivels. As a result, you have a shriveled up cauliflower ear. And so the cure for that, unfortunately, is plastic surgery, which doesn't work out very well because it's hard to find a piece of cartilage that you don't need in your body. It can be done, but it's usually very costly and difficult. So if you get a mushed ear that's got a huge bruise on it and it's all blown up and very painful, do not just leave it alone. Go and get it taken care of in a clinic. And what we do is we suck out the blood so that it collapses the sandwich back down. We put a pressure dressing on it so that that can be flat and not accumulate more blood, and the swelling goes down and it heals up pretty nicely. And you shouldn't do that yourself with a sewing needle, as I've heard.
Wow. All right.
Okay.
Well, so I mean, over the years, right? We've seen fighters come in and out, and I mean, you just look and you think, every time you see them, their ear is like that. So can there be a harmful impact to, can it affect their hearing at all?
Well, when you get punched in the ear over and over, there is a lot of, a big wave of pressure if you get punched in the ear with a big boxing glove or smashed onto the mat. So you can rupture your eardrum. The ear, the outside of the ear, that's the pinna, that is actually not really involved with hearing at all, not much anyway. So your hearing can be entirely normal, but it looks a little funny.
All right, and no way to really avoid that.
Well, I think if I mean, you could wear, if there is some kind of headgear, you definitely should wear it. And if there's some kind of wrap or something, if you already have an injured ear, don't re-injure it. Try to ice it. Those kind of common sense things. But yeah, that's a occupational hazard.
All right. So let's talk a little bit about bites. Unfortunately, we have seen some fighters get into the ring. They get a little crazy, and I guess instincts come in. They just decide to bite their opponent. So how does one treat themselves when they get bit?
Human bites are one of the most dangerous in the world because we have actually very dirty mouths. There's two people to consider in a human bite. There's the person who's doing the biting, which you got to be aware. You think you're hurting your opponent, you may actually be hurting yourself, because if your opponent has a disease or whatever, you're getting that blood in your mouth and so on, and it'll be well absorbed, and you could get a nasty disease like hepatitis or whatever. So then there's the person that you bit. The risk to them is, of course, damage to the skin, but also infection from your dirty mouth. And so if you're somebody who's been bitten, you really need to clean that out. The way we clean wounds is not with peroxide and not with alcohol. What we do is we flush them with copious amounts of water. That means gallons and gallons and gallons of fresh water and just regular soap to clean that wound and get the bacterial load off of it. So it's not so much what you put on it, it's how much you flush it out. So you're flushing it with just warm water and soap, and then people with human bites generally do need to get on antibiotics and tetanus shot if it's necessary, and of course sutures if the wound is very large.
All right, real quickly, from the human bites, which I think is a rule, you're not supposed to bite at all. You said to your kids, right? But then also you've seen when they get hit, they get cuts on the face, and then, you know, in between they're putting, I don't know, Vaseline or something on there to try to prevent it from breaking open. But how do you handle cuts?
Yeah. Okay, so the rule with lacerations is that they need to be repaired within 6 hours if they're repairable, meaning that if it's a scratch, you don't need anything, but if it's a large wound, it's got to get repaired within 6 hours. So typically the bar fights and so on happen late at night, and you know, people may not get in till the next morning, then it's too late. So be aware, you've got a 6-hour window. Again, washing the wound is very important. Putting things like peroxide or antibiotic ointment is pretty much a complete waste of time. Please do not do that. You'll just make things worse. Wash it out. Put a nice clean gauze. If you don't have a gauze, get a clean sock. Put something clean on the wound and put pressure so that it stops bleeding. And you know, again, then you're leaking body fluids. You probably shouldn't continue the fight so as not to infect other people.
Okay, sounds good. Well, we will pick up our lively discussion on bite medicine when Healthy Living returns. Stay with us.